Pneumonia is an infection that inflames the air sacs in one or both lungs. It causes the air sacs of the lungs to fill up with fluid or pus, causing difficulty in breathing, cough, fever, and other systemic symptoms. Risk factors for pneumonia include age. Children under 2 and adults over 65 are at higher risk. Poor lifestyle habits such as smoking, heavy alcohol use, poor nutrition, and being underweight. Weakened immune systems such as HIV, chemotherapy, and organ transplantation. Being around people who are sick, or living or working in crowded places. Recent surgery or prolonged immobility. Exposure to chemicals, pollutants, or toxic fumes, or being in a hospital. Symptoms of pneumonia can vary from mild to severe and may include productive cough producing mucus or phlegm, sometimes blood-tinged. Shortness of breath. Chest pain often sharp and worsens with breathing or coughing. And rapid or shallow breathing. Systemic symptoms include fever, chills, and sweating. Fatigue and weakness. Muscle aches. Confusion, particularly in older adults. Specific signs in children include difficulty feeding, rapid breathing, cyanosis or bluish tint to lips or skin. In older adults, symptoms may be atypical, such as confusion or mild cough without fever. Pneumonia may be classified depending on the causes. Bacterial pneumonia is commonly caused by Streptococcus pneumonia. Other bacteria include Haemophilus influenzae and Mycoplasma pneumonia. Viral pneumonia is often caused by viruses like influenza, respiratory syncytial virus, or coronaviruses. Fungal pneumonia is caused by fungi such as Histoplasma capsulatum, Cryptococcus. Aspiration pneumonia occurs when food, liquid, vomit, or saliva is inhaled into the lungs. Pneumonia may also be classified based on location or setting. Community-acquired pneumonia is an infection of the pulmonary parenchyma acquired from exposure in the community. Community-acquired pneumonia is classically divided into typical and atypical syndromes. Typical community-acquired pneumonia presents with typical severe or acute infection. Infectious agent is usually Streptococcus pneumonia. Other agents of typical pneumonia are Staphylococcus aureus, Escherichia coli, Klebsiella, and Pseudomonas, and it is usually responsive to cell wall active antibiotics. For atypical community-acquired pneumonia, the presentation is usually subacute. The causative pathogens are difficult to culture or identify by standard methods. They are not responsive to penicillins. Some common causes include Mycoplasma pneumonia, chlamydia pneumonia, and viral pneumonias. Hospital-acquired pneumonia develops during a hospital stay, often involving more resistant organisms. These organisms include Pseudomonas aeruginosa, Enterobacter, Staphylococcus aureus. Streptococcus pneumonia, ventilator-associated pneumonia, occurs in patients on mechanical ventilation. The diagnosis of pneumonia begins with clinical assessment. History of recent infections, travel, or exposure. Findings on physical examination include auscultation for crackles, dullness to percussion, and signs of respiratory distress. Investigations that can be done include chest X-ray that shows consolidation or infiltrates in affected lobes, elevated white blood cell count, inflammatory markers like CRP and procalcitonin, sputum culture and sensitivity to identify causative agent, pulse oximetry or ABG to assess oxygenation status, CT chest, bronchoscopy, or pleural fluid analysis if effusion present, PCR, serology, or antigen tests. Treatment of bacterial pneumonia involves the use of antibiotics. First-line treatment include amoxicillin, azithromycin, or doxycycline for mild community-acquired pneumonia. For severe cases, beta-lactam such as ceftriaxone plus macrolide or fluoroquinolone. For viral pneumonia, oseltamivir for influenza and specific treatments for COVID-19. For fungal pneumonia, amphotericin B, fluconazole, or voriconazole, depending on the fungus. Supportive care for pneumonia involves oxygen therapy if hypoxic, antipyretics like paracetamol for fever, IV fluids for dehydration, and mechanical ventilation in severe cases. The prevention of pneumonia involves vaccinations such as pneumococcal vaccines, influenza vaccine annually, and COVID-19 vaccines. Lifestyle measures such as quitting smoking. Maintain good hygiene, adequate nutrition and hydration. To prevent aspiration, raise head during feeding, especially in bedridden patients, and treat swallowing disorders promptly. And that's all for this video. If you find this video helpful, don't forget to like, share, and subscribe for more informative content. Stay tuned for our next video.